When it comes to lips, is bigger better? Are bigger lips sexier lips? Today I'll be discussing with you how to get your lips done in the most attractive way without making them look overdone. I'll be discussing with you guys my 6 tips that I use to create sexier, more attractive lips. Why do so many women go to such extreme lengths to plump up their lip? To answer this question, we're going to rewind to the 1980s, where we had one product back then, and it was bovine or pig collagen. That's right, from pigs.
Kylie Jenner to the foyer. I have a little surprise for you.
You actually needed to have 2 forearm skin prick tests spaced weeks apart to make sure you weren't allergic to the product before you injected it into the lips. Collagen never really lasted very long, and you could never really get a lot of volume with it. But about 20 years ago, hyaluronic acid fillers became popularized, and one of the first ones were actually from rooster combs.
Is that a chicken? Wait, what is that?
Subsequently, they've been made from non-animal sources, and these remain to this day to be the most popular fillers on the market. They're temporary fillers, and they have the ability to attract many times their weight in fluid or water. And by doing so, they create a large amount of volume. Hyaluronic acid fillers are able to augment lips to a much greater degree than collagen ever was. So all of a sudden, we now have the tools to create big lips. Not just big lips, but gigantic lips. Combining celebrities with big lips with social media, and suddenly you have all these role models influencing the general public. Combining this with the tendency for women to generally want to have bigger lips.
I want Jagger.
We all of a sudden have this epidemic. It started off in about the year 2000 with Angelina Jolie. I mean, she does have beautiful classic looks and some beautiful lips, and they look great on her, but not everyone has meant to have Angelina Jolie lips. Fast forward to 2015, Kylie Jenner single-handedly increased the internet searches for lip filler by admitting that she has had lip filler done. You may remember the hashtag Kylie Jenner challenge, which encouraged people to get a shot glass and suck their lips onto that shot glass, creating negative pressure, which would then engorge the lips, and the results were, as you can see here, quite disturbing. Even teens were trying it, and they were getting a lot of bruising and swelling, thankfully all of which were temporary. A quick search of hashtag lip filler on Instagram reveals a whole plethora of overdone, disproportionate lips. But is bigger better? Maybe a lot of women feel that bigger is better because lips are a sign of their femininity, their sensuality. It's the only sexual organ that is displayed publicly on a daily basis. And I mean, this unfortunately has had a very negative effect on those who just want a little bit of lip filling, some natural lip filling. After having seen a lot of ridiculous looking lips on the internet or social media or in public, it really increases their fear of being overdone in the same way. But some patients also come in with the expectation of having quite big lips, often lips that may be disproportionate to the rest of their face. And it's actually very, very hard to say no to these patients.
This is about my lips. Okay, now look at me. I want Tina Turner. I want Jagger. Fill them up.
But it is our responsibility as doctors to educate our patients and guide them appropriately. So hopefully this video will arm you with information that you can utilize when discussing with your practitioner what sort of lips you would like to have. Before we go into the 6 S's of lip enhancement, let's firstly discuss the anatomy. Let's return to the basis of what can be enhanced. We have a few structures that can be enhanced using dermal fillers. It's not just the red or the vermilion which we can enhance, but we also have parts such as the philtrums or the columns that also can be enhanced, like Angelina Jolie's actually got some really nice philtrums, but you wouldn't know that because we're too busy looking at how big her lips are. We have the upper lip vermilion and the lower lip vermilion, which are often enhanced to produce a fuller, poutier lip. We have the border of the vermilion, which can be enhanced to delineate the skin or the cutaneous lip with the vermilion or the red part of the lip. And then we have the areas around the lips, like the mouth corners or oral commissures. The cutaneous or the skin of the upper lip, which is often affected by sun, and problems such as wrinkles may need to be treated. So let's go through the 6 S's of lip enhancement. Now, the first S, which is not necessarily the most important one, but it's often the most commonly thought about one by patients, which is lip size. We have to look at the size of lips in terms of balance between the size of the other parts of the face, for example, the size of the eyes, the nose, and the cheeks, the chin, and how that fits in. For example, if you have a much stronger nose and chin, you could probably have bigger lips. If you've got smaller eyes, you probably don't want to have huge, gigantic lips. If you look like Janice from the Muppets, you're in trouble. Often the standard amount of filler for lips is 1 ml. Now, obviously this varies between person to person, but often I find myself as a practitioner injecting much less than 1 ml into the lips. And in fact, often sharing that 1 ml with other parts of the face. Fillers generally come in 1 ml syringes. So naturally our tendency as practitioners is to inject that whole ml into an area, say for example the lips. Some people even go for more than that. But in fact, often 1 ml is a bit too much, and it can be very hard to judge size as a practitioner when you're injecting because as you're doing the procedure, you get a lot of swelling, and this happens almost immediately. And sometimes you end up with a bruise as well, which also makes it more difficult to assess how much or how big the lips will become. To avoid swelling and bruising, I prefer personally to use a cannula, which is a round tip tool, and it's not sharp like a needle, so it can actually weave its way through the lip, and there's only one entry point in each quadrant of the lip instead of multiple injections with the needle, and this reduces your swelling and bruising significantly, allowing the practitioner to have much better judgment of what sort of size to make the lip. So we can use a few rules in terms of size, and one of these is phi, or the golden ratio, and this states that the upper lip to lower lip ratio should be 1 to 1.618. And the other rule that you can use to judge lip size is Ricketts' E-line, or aesthetic line. Ricketts was an orthodontist. He looked at the proportion of the nose and the chin to the lips and soft tissue and teeth. If you draw a straight line between the tip of the nose and the chin, the average Caucasian should have the upper lip sit back about 4 millimeters from that line, and the lower lip about 2 millimeters from that line. If you have lips which are protruding up to that line or beyond that line, your profile will be very lip dominant. And if your lip sits well behind that line, then you have a more nose-chin dominant profile. Often you see where patients have had lips overdone, their lips extend way beyond the Ricketts E-line. The next S is shape, and shape is important because when filling lips, you don't want to have 2 Frankfurts. That is the worst outcome. Filler should be more centrally placed in the lower and upper lip. I find that looks a lot better and allows you to have a bit more of a shape to the lips. That is, a lip is fuller in the middle and thins out towards the sides. Lip filler placed very laterally in the lower lip also causes a lot of that Frankfurt sort of look, which is really undesirable. Ray Morris, a very well-respected international makeup artist, actually draws her lip liner not all the way to the side. She actually ends her lip liner short of the corners of the mouth, which means she's giving the whole lip more of a shape, less of the Frankfurt look. Support is a very important S when it comes to lip enhancement. Now, when we're talking about support, we're talking about making sure that the mouth corners are supported so that you don't have drooping mouth corners, which can be very aging. Another important area of support is the crease in the upper lip, often arising from sleeping on the face, on the side of the face. And if you don't fill in this crease here, often filler in the vermilion will accentuate this crease by pushing back on it and causing more of a crease. So it's important to support that area with a bit of filler. Symmetry is an important part of lip filling also. Lips are probably one of the most important structures, as well as the nose, that needs to be symmetrical on the face. You can have, eyes which are higher than the other. You can have ears which are different height. You can have different height cheeks. But centrally, we need our lips to be symmetrical. Now, it can often be hard to actually make lips that are not symmetrical with dermal fillers because, often one side is longer than the other, for example. Often it's important to point out to the patient that they have some slight asymmetry. Otherwise, they may attribute this asymmetry to the dermal fillers itself, if not pointed out prior to filling. The skin is also a really important part of the lip enhancement process. Often it's important to look at small amounts of filler to be injected into the fine lines or wrinkles on the upper lip. This can be done with a very fine needle, injecting filler superficially. It only takes a very minuscule amount of filler to correct these lip lines, but often correction is not complete, and if the lines are more severe, often a laser will be required, such as an erbium laser, to resurface upper lip lines. And the final S is selection, and that is, as a practitioner, we have to be careful how we select our patients for lip enhancement. Those obviously with unrealistic expectations need to be guided in the right direction. Also, patients with very, very fine, tight lips, often they're the ones carrying pictures of Angelina Jolie, but often these patients who are very tight-lipped, we find that filler only lasts for 2 to 3 weeks in their lips before it sort of disappears in their words. And I believe this is possibly due to the tightness of the lips causing migration of the filler up underneath the cutaneous or up underneath the skin part of the lip, which basically doesn't show that you've had any filler in the red part of the lips at all. There's my 6 S's for lip filler enhancement, and I hope these tips will help you understand lip enhancement better and help you decide what you might want for your lips. And remember, when having lips done, you're not at the petrol station, so there's no need to ask to fill her up. Look forward to seeing you in our next video.
Fill 'em up!